Tonight now, you probably assume that when you go under the knife, your surgeon is there for the entire procedure.
But that may not always be the case. So what's really going on in your OR? CBS 2 investigates double-duty doctors. Moments before going under anesthesia, it's comforting to think your surgeon will be right by your side the whole time. But as you drift off to sleep, that doctor may actually be drifting out of your room.
Most people don't even think to ask their surgeon, while you're operating on me, are you going to be there the entire time? And or will you be doing another operation?
It's a practice called simultaneous or concurrent surgery.
Someone's going to be there to begin the surgery. The specialist will come in at the right moment to do whatever needs to be done. And then they're going to go down the hall and do the same thing.
In 2005, pitcher Bobby Jenks helped the Chicago White Sox break the team's 88-year wait for a World Series win. He went on to play with the Red Sox and in 2015 told the Boston Globe this is exactly what happened to him.
I had no idea that there was another surgery booked at the same time.
He maintained his major league career ended after a botched back operation was performed by a surgeon working in 2 different rooms.
The more we looked into it, the more intriguing it got.
Jonathan Saltzman is a reporter with the Boston Globe. He, along with his Spotlight team, started investigating simultaneous surgeries after speaking to several doctors who blew the whistle on the practice.
In many hospitals around the country, particularly teaching hospitals, it's not uncommon.
After the paper started raising questions, the Senate Finance Committee surveyed 20 teaching hospitals around the country and found 33% of their surgeries are double booked.
It's part of a larger system-wide problem.
Medical malpractice attorney Ernest Franzuto says the practice is all about money.
It's no different than a doctor who typically would see 4 patients in an hour, but now is booking 8 patients in an hour.
Except with double and sometimes even triple booked surgeries, there are a lot more risks, says Dr. Arthur Kaplan, a bioethicist with NYU School of Medicine.
It's not because the surgeon isn't necessarily skilled, but they're working with teams. And so if the anesthesia suddenly goes wrong or the blood transfusion isn't taking place right, they're looking around to say, well, where's the lead surgeon?
Well, now you have another patient who's now literally left with a resident or a fellow who they've never met and otherwise would have never given informed consent.
So I just did a big follow-up story on a urologist who does this in New York, who is a celebrity surgeon.
That surgeon is David B. Samadi, chairman of urology at Lenox Hill. Saltzman says Samadi is currently under investigation by New York State. Lenox Hill refused our request for an interview, but in a statement said, Dr. David Samadi is a world-renowned prostate cancer specialist with excellent clinical outcomes. A spokesperson went on to explain the hospital doesn't actually perform concurrent surgeries, only overlapping, which allow for both patient care and valuable teaching while reducing wait times. Still, critics say doctors should tell patients their plan up front. Now, several studies have shown that simultaneous surgeries do not increase the risk to patients and in some cases actually improves outcomes. Bottom line here, if you are concerned, ask your doctor if she or she does this before booking your surgery.